had an injury where you've had this unrelenting pain, achiness, tightness on the side of your hip? If you have, you're not alone. Pain on the outside of the hip is one of the most common injuries that people go to their doctors for. It's also one of the most common hip-related running injuries that you can get when training for an event. So how are these symptoms managed when you present with pain on the outside of your hip? A really common treatment is just an injection that you can get in your doctor's office. About half of the time, this intervention will be very effective. But the other half of the time, there's still lingering symptoms. And even when you do have good luck with an injection, typically these symptoms return. Why is this? Well, when you do an injection, it typically will address any type of symptoms or inflammation that you have in the bursa that surround the tendons that attach at the side of your hip. So bursal injuries, the thing to know about those is that they do not typically occur in isolation. You know that around the hip there are a lot of tendons that tie into this bony area on the outside of your hip. Lingering symptoms are oftentimes due to injuries and weakness that exists inside of those tendons that sit below and above the bursa that get injected. Lingering symptoms in this area are typically a sign that you have overloaded somehow and overworked the tendons that attach right at the side of your hip. So how do you address tendon pain? How do you manage symptoms other than an injection? One of the most effective ways for reducing pain and sensitivity of the tendons around this area of your hip is to reduce the overall cumulative stress that your tendons in your hip are exposed to throughout the day. How do you do that? You do that by paying close attention to how you sit, stand, and lay throughout the day and when you go to bed at night. What are postures and movements that are going to keep excessive stresses going to an irritated tendon? For one, you want to make sure that when you're sitting for any length of time, you're sitting with your knees slightly lower than your hips. You do not want to cross your legs. If you have armrest, you don't want to lean into one armrest or sit with your hips shifted off to one side. When you stand, you really want to watch and make sure that you're not hanging off into one hip. This is a really common thing that's easy to do throughout the day. You want to watch and make sure that you keep your weight centered through your feet. When you lay, if you're a side sleeper, you want to try to lay with pillows between your knees to help take stress off the outside of the hip. Isometric exercises done regularly throughout the day can also be helpful for relieving symptoms on the side of the hip.
An isometric exercise is when you activate a muscle without actually moving the joint it crosses. In the case of the hip, you can actually lift the leg and hold, or you can push outward into something such as a belt that will keep your knees from moving and give you some light resistance to push against.
For the hip, you can do these exercises either when you're sitting, if your hips start to ache, if you sit for a long period of time, place your hands on the side of your knee, gently push out into your hands to create some nice, deep, gentle tension in the side of your hips and hold that for 30 seconds. You can also do 10 times turning those muscles on and off, push out into the knees, relax, push out into the knees and relax. You can also do this in bed at night. A common report in patients with injuries to these gluteal tendons is that the hip will ache at night. It can be helpful to put a belt around your knee and do the same thing. Push out gently, create deep, gentle tension on the side of the hips, hold for 30 seconds, repeat several times. You can also do 10 times repeated contraction, push out, relax, push out, relax. This can also be done in side lying, where you lay on your side, lift the leg halfway up, hold for 10 seconds, come back down, and lift again. Repeat that 5 to 10 times. Do these things regularly throughout the day, especially do them when the hip starts to ache. I know I personally have had some issues with aching on the side of my hip when I go to sleep. My choice exercise when that happens is to do the sideline leg lift hold. When I do it, I don't lift it very high. I just hold it nice and light, do it several times, and for me that takes the edge away of that ache. Give these exercises a try. If you have persistent pain on the outside of your hip that just won't go away, do them regularly. Use them like pain medicine. Stay on top of your pain, stay on top of your stiffness. Do them 6 to 8 times plus a day.
If you like this video and would like to see more, please like and subscribe to my channel below.